Good day and welcome to the webinar. My name is Mark Maloney. I'm the CEO of VenOps. We are a compliance company that specializes in medical practices and especially independent medical practices. Today's program is brought to you by Indie Practice, which is a platform designed to help independent medical practices in partnership with the Medical Association of Georgia. Our guest today is Rick Cancellaire, the CEO and founder of PracticeBeat. PracticeBeat is an amazing company that will make any medical practice competitive with the biggest competitor in its neighborhood. So I will now introduce Rick. Let him take it away. Rick, the floor is yours.
Thank you, Mark. And thank you to Indie Practice and the Medical Association of Georgia for the opportunity to have worked with both organizations now for several years. So today I've been asked to talk about how PracticeBeat can bring your practice new patients in about 30 days. And I want to first kind of explain who we are and what we do. You know, as the founder and CEO of TreatSpace, when we launched PracticeBeat as a business, our goal was to help independent practices outperform health systems on Google, right? Because they don't have access to multi-million-dollar budgets, right? They don't have access to large marketing teams. And what most practices don't know is what's blocking patients from finding them on Google, right? And what if I told you that there's a giant wall that's preventing hundreds, if not thousands, of patients from finding you every month? And that wall was built quite literally to direct and route patients away from you, right? And that Google is the wall. And most people watched them really kind of destroy the yellow pages over the last decade. And they hadn't put their finger on why it's happened and what's occurred, but they're constantly checking your credibility as an organization with fact checkers. They're testing your performance with their tools like Google Chrome, right? They're assessing your authority in your specialty. And it's becoming more and more of an issue. And they've basically built this floodgate to redirect a massive wave of patients either away from you or towards you, right? And Google wants to give patients an amazing experience. They're not evil. They're not trying to punish practices, right? But they look at trust, right, in three different areas, right? Credibility. And when I say credibility, I don't mean credentials, right? Credentials like we think of in healthcare, performance and authority. And most of these things are technical oriented. Like they're looking at your name, address, and phone number accuracy across 75 fact checkers, right? They're looking at your reviews and your ratings. They're assessing whether or not your site is secure, right? They're looking at your practice page speed on your website. Is there high bounce rates? Is it effective for someone who's disabled, right? Can somebody trust this practice based on what they see? And essentially, practices that fail the tests lose the patients, right? And practices that pass the tests win the top positions, right? Like the physicians in Calhoun, Georgia, in multiple locations, right? If you look at, if you're in Calhoun, Georgia, and you're searching for spine pain, which is obviously as a spine rehabilitation specialist, a high volume keyword for them, they perform number one organically, right? And on the local pack. And that's pretty meaningful for an independent practice, right? They want to outperform health systems, right? Peach Dermatology, right? In Suwanee, Georgia, right? Number one in their market, right? These practices that pass the tests win the top positions. So let me just kind of step back. So what? Why does that even matter, right? I mean, who's using this anyway, right? When you look at family doctor near me, right? Let's just kind of dive into what family doctor near me is. And I'm going to just pick on Suwanee, Georgia, right? Or Savannah, Georgia, right? I'm just going to jump right in here and look at a search. And I've got tools enabled on my system, right? Whenever I do a search, I can see how many patients are searching per month in that keyword, right? So family doctor near me has a volume of 60,500 searches per month. That's a lot of patients, right? So thousands of patients don't see you if you don't show up in these searches. That's why this matters, right? And when you look at the anatomy of search, a, a typical search engine result page, it's called a SERP, SERP. A search engine result page is made up of different pieces. There's the ads, there's the maps, and then there's the organic search results, right? And when it comes to the ads in healthcare, click through rates for medical practices were 3.6% in 2021, right? That means that most people will skip over the ads in healthcare and go directly to the local pack or the organic, right? And 80% of the clicks happen before a patient has to actually scroll. And it breaks down in a way that you can actually kind of look at, right? You can actually see, okay, the local pack gets about 17 to 25% of the clicks, right? Just on the first selection. When you take out any of the pay-per-click ads that would have happened, right, in healthcare, because in healthcare it's only like 4%, right? So all that traffic goes down here to the local pack or organic search. So that means organic search, right, instead of 27%, add in a bunch more, right, from those pay-per-click ads that won't convert here, that goes up to about 30 to 35%, right? Just the first organic search result. So having that first local pack and that first organic search result yields upwards of 50 to 60% of the traffic, right, in a search if you can capture those top positions. Most practices say, why isn't Google picking me, right? Why am I not showing up in these searches? What you see, right? You as a practice, you look at your staff, you look at your team, you look at yourself, you look at your history, you look at the patients you've changed, right? You've the people you've bent over backwards to really care for, right? You've gone out of your way, you've opened your schedule, you've taken late nights, you've gone into the hospital at very difficult times. Like you look at that time and you look at your practice and you see something very different than what Google sees. Google sees a very different picture based on technical debt, right? And that technical debt creates online patient leakage. And there are things that you just typically wouldn't expect, right? Misalignment with Google, reputation issues, SEO related, performance related, security issues, information management issues, fact management. There's a lot of different pieces to how this works, right? And Google is made up, their search algorithm is made up of all these different segments, right? You can actually Google each piece of Google's algorithm and read about it. There's a piece called Panda. Another one is Penguin. Another one is Hummingbird, Pigeon, Mobile, Fred. A lot of them are named after birds, right? If you Google each piece of the algorithm, you can see what Google's looking for. So you can Google Penguin. And I always point out to folks when I'm talking to them that if you click on Google Images, it kind of tells the story without like having to go deep into the actual details that are really technical. And oftentimes you'll see, like for Google Penguin, you'll see a penguin with a knife, right? He's got like a machete. And each piece of the algorithm is looking for different things. And it's assessing the practice in real time in these different categories. And your website is just one piece of your web presence. You have to make sure that your systems, your website, your listings, your reputation, all the all the components of your web presence meet and exceed the standards that Google has set, and the standards that continue to change week after week, day after day, month after month. Working with Google is very difficult if you're going to try to do it directly. You need like a CTO and someone who can manage a tech stack, an IT group, right? It is painful. This is why working with us is easy and enlightening. We've kind of disrupted the process of how this works. And in our partnership with the Medical Association of Georgia, what we do, right, is we provide the first 4 steps of engaging with us at no cost with no obligation. And it's a lot of work, but we do it all, right? Without any paid options, nothing costs anything, right? For the first 4 steps. And we diagnose before we prescribe. The first thing we do is we have nurse informaticists pull your data before we meet with you. And we present this data when we connect with you. We connect on market size data. We look at your market share in that market size, and we track your patient leakage. We show you these numbers the first time we ever speak to you. We also look at the opportunities that you have by reviewing competing practices, right? We prepare research summaries and overviews, and we provide those to you so you can share them with your team. You can assess them with the owners of the practice. You can meet with anyone that are additional stakeholders to address what's going on, right? That's really the first step, right? In the Medical Association of Georgia, they partnered with us because they want to help independent practices grow, right? Indie practice is really focused on this as an organization. And so as a part of that relationship, we're going to help you track your market share for free, especially as new entrants and hospital systems and private equity groups launch expansion and penetration strategies in your regions, right? We're also going to monitor patient flow. We're going to understand the volume of new patients that are seeking care in your region, and we're going to understand where they're going and why, right? Third, we're going to look at high value patient revenue streams and where those patients are currently going and how to increase your visibility of those high value services that drive practice revenue, right? If you're a very busy practice, right, how do we make sure that the patients that are the highest value patients are getting in and that you're visible in those opportunities as well, right? Finally, we're going to talk through removing the barriers to care that exists so that we can make informed decisions to ensure that all patients have access to the services that are there. So we go very deep in market share overview and analysis, right? We pull your market segment, the eligible traffic within that segment, and we show you your share of that segment, right? The next piece is we go deep into your competitive diagnostics, and we're going to walk you through how the competitors in your region are performing, what they're doing, what's different, why it's meaningful, and then we're going to go into a patient leakage overview, right? We're going to look at all the people that are searching and what searches are high, low, and medium volume, right? Where you're showing up and where your competitors are showing up in the local pack and organically. We're going to look at clicks. How many clicks are you getting? We're going to look at sessions. How many patients are coming to the site and spending time there? And we're going to look at conversion into calls and appointments. And we're going to look at patient leakage. Most practices are not aware that their funnel looks like this, right? They've got a blocked funnel. Their clicks are actually leaking, right? And their sessions are not performing very well to get to the conversion, right? And so we're going to walk you through any gaps that exist there, and we're going to leave the call with a treatment plan and tell you exactly what you do to increase your share of search, what you need to solve, how you should decrease your bounce rates, right? Any kind of leakage, right? By what you need to solve there. We're going to look at conversion rates and tell you what you need to solve there as well. And if you're interested, only if you're interested, we'll walk you through how we would work with you to address that blockage and that leakage, right? And support you with some of the systems that we have in place as a business, right? It's we diagnose, we prescribe, we provide treatment options, and if we engage, we meet with you quarterly to present what we've done for you in terms of return on investment, where your positions are. We revisit this funnel. We show you where your challenges are, where we've really helped you, and we look at those numbers quarter after quarter, and we track your growth and your progress, right? Most practices don't know that you can track a lot of KPIs. We not only track all those KPIs, but we hold ourselves accountable to those KPIs as we meet with you quarter after quarter. Next, I want to talk about why a practice needs a marketing budget. It doesn't matter if you're a new practice or an established practice. There's 4 key buckets that kind of fit in here. And the first one is visibility, right? Visibility is an important piece to your marketing as a practice. Most practices want to outrank their competitors in the region. If you're a new practice, you have to compete with established practices and you have to create a market shift towards you. Whereas if you're established, you have to compete with new entrants and prevent market shifts from steering patients away from you, right? And in terms of new patients, when you're a brand new practice, you want to drive that new patient volume towards you and create a predictable new patient demand flow, right? Whereas an established practice is really trying to protect and track new patient volume from online channels, right? And really lock it down and make sure that they're keeping their tabs on their performance in that space. Now, from a trust and authority standpoint, you also have to establish a reputation as a new practice, right? Ratings and reviews, but you also have to build credibility and authority with the search engines. That's not easy to do. You need a partner that's going to do that for you and show you how to do it. You, as an established practice, you have to modernize your digital front door and protect the legacy of your practice, what you've created, right? You have to make sure that digital front door is current and meeting the standards that everything has kind of shifted to in the last decade, right? The front door of the practice really shifted online, right? Used to be your lobby, right? Now it's really a digital front door. Now, in terms of preventing leakage, right? You have to monitor out migration. You got to really, and both new and established practices have this challenge. You have to track and eliminate bounce rates, preventing digital patient leakage, right? Most practices don't have any idea that 30 or 40% of their web traffic is literally just clicking the back button because of performance issues. And we show you that and track it for you. We give you Google's data in our first call on that point alone. We also look at patient flow, right? Tracking the volume of new patients that are seeking care regionally, right? Where they're going and why. You're going to get that data with us quarterly. We're going to look at that information. You also want to target, right? You want to increase your revenue per patient by targeting the highest value patient segments, right? That are most important to the practice in terms of revenue, while also being open and available to everyone, but really making sure that those high value patients can find you. And whether it's focusing on a particular payer segment or increasing surgical conversion rates, there's a lot of different ways to do this based on your specialty, right? And you need a partner that really can speak that language. In terms of reputation management, you want to automate reviews, stand out as a leader in the region. You don't want to be outperformed by competing practices. It's compounding interest when you get those new reviews flowing in an automated way, right? Especially when they're 4 and 5 star reviews. You want to prevent any variation as you grow, right? You want to make sure that your online reputation really matches your offline reputation, right? And you want to understand and track any variation there between all of your locations and all of your providers, because Google assigns reputation and ratings to all locations and all providers. Because you can Google the name of a doctor, right? You can see their review. You can Google the location of a practice and see that review. So you want to make sure that there's no variation, that there's a good, excellent reputation across the board, right, for all locations, all providers. You also want to look at the opportunity to reward providers, right, for having top performance in patient satisfaction, right? And there's lots of ways to do that, but even as you're a busy practice and as you get busier, you want to simplify patient access and streamline by simplifying and automating and integrating, right, your systems, patient intake, right, making sure that HIPAA compliance is there, making sure that your reputation is automated, all the different components that really reduce workload by streaming and automating some of the services attached here. That's why a practice really needs a marketing budget. Even the busiest practices leverage our systems to optimize their operations and efficiently manage high patient volumes, right? And they maximize their revenue by targeting specialized procedures, right? They identify and focus on those most profitable, high value procedures. They prioritize financially rewarding procedures, and they maintain patient centered care across the board in all areas. But they're also attracting those high value cases, right? Especially in surgical specialties, right? Where practices use targeting to strategically increase conversion rates on those high value cases. A good example, right? This is a practice we work with in Texas, right? When you search for bunion pain in San Antonio, right? You're going to see bunion correction surgery really pop right at the top of them because they really want to make sure that those patients find them, right? And through integrations, right? When we launch a lot of new practices, right? And Medent, an EHR that we work with, just actually posted a podcast yesterday of Dr. Bartolomucci telling his story of launching with PracticeBeat, right? And when he launched in May of 2021, he had no reviews. He had no reputation at all, right? In March of 2023, right, he had 44 reviews. His integration went live with Medent about 4 months before that, right? He went from hardly any reviews to over 40 reviews, 5 star. And today he sits at over 80 reviews as a 5 star provider, which is kind of interesting because he's no longer taking new patients. We launched him with 0 patients, and in less than 2 years, he's filled his panel completely and he's no longer taking new patients, right? We love his story because he's outperforming 3 multi-billion-dollar health systems in patient acquisition in his market, right? Same thing with another practice here. This practice launched with us in April of 2021 with no reviews. Today, they have triple digits of 5 star reviews, right? We're very accustomed to seeing this happen. And we diagnose a practice in a lot of different ways. When we start working with someone, we really dig into the data and we look at what blockage and what leakage is preventing patients from finding them, right? And when we started working with this practice, right, we really dig in and we look at those pieces of the algorithm. Remember all those like weird birds, right, with knives? And we show them if you correct the challenges, the gaps, right? The issues that are preventing patients from converting. We show them, do you realize your visitor loss is at 35% because of your load time? Do you realize Google can't see you on a map because you're not using specialized technology? Do you realize your name, address, and phone number doesn't match on all the sites that Google tracks? right? Do you realize how many impressions and opportunities you have, but how many clicks and sessions that you're losing, right? How many appointments could have been captured as a result? When we started working with this practice, we showed them all their data, and 30 days later, we completely relaunched everything, right? Today, this practice has the top positions in both the local pack and organic search result in their market because they have a team managing their technology platform, their web presence, not just their website, their web presence, all the key components of their web presence. We manage over 300 different things for a practice in all the different categories that matter, right, when it comes to this. And we're very accustomed to tracking in Google Search Console the performance of a practice before us and after us, right? There's a hockey stick growth curve in terms of impressions and clicks, right? And we look at that and we track it quarter after quarter. And in a month, right, this practice grew their visibility, right? They grew their credibility, they grew their performance, they grew their reputation, right? They grew in so many areas, right? And really became a digital force in their region. And that's what we love to do. We love to help the independent practices outperform health systems, right? Taking those practices that are independent, that have multi-billion dollar health systems competing against them, right? However, they perform the top in their specialty, right? The hospital systems, they are secondary, right? That's what we love. That's the aim that we have with every customer. We would love to pull your data. We would love to pull your information, right? If you go to treat.chat, you can schedule time with us as soon as early next week, right? We'll pull your data before we meet with you. Our nurse informaticist will dive in and start pulling your information. And again, the Medical Association of Georgia has partnered with us through Indie Practice to help you track your market share, to help you monitor your patient flow, to help you understand where you can grow high value patient revenue streams, and to remove barriers of care. The diagnosis, the market share assessment, all the different areas of patient leakage, and building out your treatment plan are no cost to you, right? This is all through our partnership with Indie Practice and the Medical Association of Georgia. And we would love to provide that information to you. And I look forward to that opportunity. And that's really all I have.